This patient was referred to me for endodontic treatment of tooth number 15. So take a look at this tooth. Composite restoration, recurrent decay, approximating the pulp of the tooth. Again, it's really important to evaluate a tooth thoroughly and completely, so that way you can talk about your findings with the patient. That way you tell the patient what's going on and what you need to do. For example, I'm an endodontist, right? Okay, so I can talk to the patient about the endo problem, but then this patient, if I miss other things, other stuff that are associated with the tooth, I may give this patient the impression that the root canal will take care of all his problems, and the root canal is all this tooth will need. So that's why it's important to do a thorough evaluation examination. So when you talk to the patient, you can talk to them about the problems that the tooth has and what you are going to do to address those problems. For example, I'm an endodontist, so I'm a root canal specialist. All I do is root canals. If this tooth has other issues, other problems, other needs, I don't want to give the patient the impression that the root canal will be all this tooth will need, right? Because if I do that, then I do the root canal, and the root canal may be fine, but if the tooth has other problems, then the patient will be back here and say, I thought the root canal will solve my problems. I still have some symptoms. Then that means that I didn't inform this patient properly. So that's why this patient has unattainable expectations from me. So the root canal part is pretty obvious. This tooth will need a root canal, right? So, for example, now, if I don't probe this tooth, if I don't pay attention to the radiograph here, then I miss something that's very important. And that is look at this. There's a food pocket here, a chronic food pocket that patient also confirmed. He said, yes, you are absolutely right. There's a food pocket here. I'm constantly cleaning this area. There's a food pocket here. Okay, so if I don't document that, if I don't tell patient that the root canal will not address the food pocket, then the patient might be under the impression that the root canal will solve all the problems that this tooth has, including the food pocket. So this area, mesial of tooth number 15, probed 6 millimeters with BOP. So I inform patient of all my findings. This tooth definitely will need a root canal if you try to save it, right? We're going to do the root canal. You're going to leave with a temporary filling in the tooth. But I told the patient, the food pocket will not be resolved by the root canal, nor will it be resolved by what your dentist will be doing after I'm done with the root canal, which is building the tooth up and crowning it. Putting a crown on this tooth will not get rid of the food pocket there. That intraproximal bone loss and chronic food impaction has caused a perio problem right here. So I told the patient that. I said, I'll do the root canal. Your dentist will build the tooth up and crown it. In the meantime, your dentist will have to refer you to a periodontist. And the periodontist will need to address this food pocket here. Otherwise, you will continue to get food impacted here. And 6 months after the root canal and crown, you'll get another cavity. And there's a procedure that periodontists usually do. It's called a pocket reduction surgery. And they can get rid of that artificial food pocket there. All right. But that's something that a periodontist needs to do. So if I didn't tell the patient this, I might have given the patient the impression that the root canal would have taken care of all the needs of this tooth. Okay, so now I document that in the patient's chart note that I discussed my findings with the patient. This tooth will not only need a root canal, but a periodontist now needs to be involved to get rid of this chronic food pocket there that's caused a perio problem. Okay, so now the other thing that I need to do is I need to talk to the patient about the alternative. So I tell the patient, if you don't want to go through all of that root canal and build up and crown and perio, then the alternative is extraction. And again, I document that in the patient's chart notes. Okay, so that's what we need to do. Now, a lot of times patient asks me, I don't know what to do. Well, if they don't know what to do, I tell them, you need to think about it. Sometimes so don't schedule with me because, right, I'm not trying to sell you used cars. So I tell you exactly what's going on. If you can't decide what you want to do with this tooth, whether you want to save it or try to save it, whether you want to extract it, go home, take a day, take 2 days, and think about your options. If you decide that you want to try to save the tooth and go through the process that we talked about, then call me, schedule an appointment with me. Otherwise, if you decide to extract the tooth, you don't even need to call me. You call your dentist and have your dentist arrange for the extraction. Okay, sometimes patients ask me, you tell me what to do. I refuse. I say, I'm not going to tell you what to do. This is not my tooth. It's your tooth. You need to decide. Remember, the moment, I always tell you, the moment you decide for a patient, because they can make the decision and you decide for them, is the moment that you buy all the problems that are associated with that tooth and maybe other teeth too. So never ever make a decision for the patient. You need to let the patient decide what they want to do with their body part. Okay? So never fall into the trap of being so eager to help a patient that you make a decision for them. Because anything happens to this tooth after that, once you make the decision for the patient will come back to you and say, I wanted to extract this tooth, but you pushed me. You pushed me into trying to save it for, usually they say for financial reasons. And I wanted to pull the tooth. You convinced me to try to save it, and now I still have problems with the tooth. So this patient was referred to me for endodontic retreatment of tooth number 2. According to the patient, this root canal was done in Moldova about 2 years ago. All right, so take a look here. That's composite buildup. That's the MB root. That looks like a lentula. All right. Look at the palatal canal there. Look how short the fill is there. What do I always tell you guys? Never, ever, ever rely on just one x-ray, one PA to make a diagnosis. Remember that? All right, so let's take a look at another angulation here. That's the broken lentula right there. That's the palatal canal right there. Let's look at a different angulation. Again, you can see the broken lentula here, palatal canal there. Look how short that fill is. Look at that. Look how short. No periapical lucency. No periapical lucency here either. All right. Let's look at a different angulation. All right. Again, you can see the broken lentula here, and it looks like it's actually out of the canal. Look, the DB canal was missed completely. Look at the palatal canal there, and look how short the fill is. Again, no periapical lucency here, no periapical lucency here, no periapical lucency here. Patient has 0 symptoms, no symptoms whatsoever. Tooth was within normal limits, responded within normal limits to percussion, palpation. Probings were 2 to 3 millimeters all around. So here it is. Again, you can see the lentula is out of the canal. Patient has no symptoms. Again, broken lentula right out of the canal, missed distal buccal canal. Look how short that fill is. This is like a whole bunch of lessons for you to learn. Dr. Lin here, the extent of obturation has no effect on the outcome of the endodontic treatment. Broken lentula out of the canal there. Some of you think, oh, every time this patient bites down, they should be in pain because the broken lentula is sticking out of the canal and it pokes them into the bone. Missed distal buccal canal, no issues. No problems, no issues. So, no endodontic retreatment is necessary. Again, this root canal was done 2 years ago in Moldova. No endodontic retreatment is indicated here. Or just because you see all kinds of problems doesn't mean that you have to now go and automatically redo the root canal. This patient has no symptoms. Multiple angulation PAs show no issues as far as the infection, the dental abscess, dental infection go. No dental infection. So many mistakes by the general dentist, but this patient got lucky because there are no microorganisms, no bacterial microorganisms in the canals. So this root canal, despite the fact that it looks terrible, is a successful root canal.